Hello MMU community, my name is Melodie Jolley and I am one of the nursing faculty members here at Martin Harold College of Nursing and Health here at Mount Mercy University. Over the past 5 months, I've worked closely with the Pandemic Task Force to provide scientific insight on the latest research regarding COVID-19, one category being face coverings. In this video, I would like to share with you some of the science behind masks and other face coverings that show why wearing a face covering is so crucial. All research articles mentioned in this video will be listed in the YouTube description below for you to refer to whenever you'd like. As a nurse, it's been common practice for years to wear face masks. We do so to protect both ourselves and, more importantly, our patients from any respiratory-based infection. So why do we wear face masks? In healthcare, all of our protocols stem from evidence-based practice. This means that anything that we do, such as wearing a face mask, is supported and grounded in peer-reviewed research. Peer-reviewed research dictates what we do because the rigorous methods used for data collection and its unbiased approach gives us clear evidence of which practices are effective and thus should be implemented and which ones shouldn't. With that being said, let's see what the peer-reviewed research is saying about wearing face coverings during the COVID-19 pandemic. Thanks to a recent research article published by MIT and Oxford University, it is now shown that COVID-19 transmission from one person to another is more complex than originally thought and that the virus is spread via aerosolized droplets. This means that the virus is spread by tiny droplets that leave our nose and our mouth while talking or even just simply breathing. The louder we need to talk, the more droplets are released. These droplets are so small that they can float in the air for long distances, sometimes even farther than 6 feet, and for even longer periods of time with inadequate ventilation, like for example in gyms or crowded bars. People become infected with this virus when they inhale these airborne droplets or rub their nose or eyes with an infected hand. However, the majority of the research community concludes that the main mode of transmission is by inhaling the virus. So knowing this, face coverings can help prevent the spread by catching the aerosolized droplets as they leave the nose and mouth of the infected individual. As we sit in classrooms that have been used by others throughout the day, wearing face coverings will help prevent inhaling floating aerosolized particles that may contain the virus, thus protecting you. There are, of course, various percentages of protection that masks can give you depending on the fabric it's made from. A study published in July of this year showed that homemade masks, when worn correctly over the nose and the chin, removed anywhere from 28 to 60% of particles floating in the air. Surgical masks removed anywhere from 50 to 75%, and N95 masks removed over 99% of aerosolized particles. Face shields are effective in blocking larger droplets from the wearer by 91 to 96%, thus minimizing the spread. However, a study from the National Institute for Occupational Safety and Health showed that face shields alone reduce inhaled aerosolized droplets by just 23%. This is one crucial reason why wearing face shields alone does not grant you enough protection against the virus. A peer-reviewed paper published in June showed that communities that wore masks 80 to 100% of the time were able to effectively control the outbreak of COVID-19 and flatten their curve, especially in combination with quarantining, while models with only 25% mask use among the public or less resulted in a large spike in infection rates as well as an even larger secondary wave of infection and deaths, which is very similar to the development that we are currently seeing in the United States. As you can see, the research draws a very clear relationship between mask usage and the COVID-19 infection rate, and I've only scratched the surface of the numerous studies with the same conclusions. Wearing a mask helps prevent the spread of COVID-19 tremendously. From all of us at Martin Harold College of Nursing and Health, as well as all of us first-line responders in healthcare across the country, please wear a mask so we can finally take control of this pandemic and keep each other safe as we start this academic year. If you have any questions or concerns, please contact Mount Mercy's Health Services under Health Services at mountmercy.edu. Thank you.